Hi, my name is Briana Goldberg, and today I will be presenting research that I conducted at the University of Ottawa for my master's thesis. This project was done as part of a collaboration with the University of Ottawa and Crossroads Children's Mental Health Center in Ottawa. I would like to give credit to Dr. David Smith, Dr. Jessica Whitley, and Dr. Maria Rogers for their contributions to this paper. The full manuscript is published in the Journal of Child and Youth Services in February 2022. Bullying involvement is a pervasive problem, and in Canada specifically, at least 1 in 3 children are a victim of bullying. The majority of the research has focused on decreasing bullying through school-based interventions, whereas fewer studies have evaluated intervention programs that have incorporated parenting into their efforts to reduce bullying involvement. It has been suggested that taking a relational approach to bullying behavior may be advantageous in addressing bullying involvement. Tackling this pervasive issue is critical as bullying involvement is associated with negative mental health and academic outcomes. It has been found that the relationship between bullying involvement and mental health is bidirectional. The objective of this study was to investigate a subset of factors that are possibly associated with a distinct pattern of school bullying within children accessing mental health services. More specifically, this study set out to answer 3 questions. Do children who are accessing mental health services and who display specific patterns of involvement in school bullying show significant differences on selected mental health indicators, parenting challenges, and on individual strengths? This study used de-identified clinical data taken from Crossroads Children's Mental Health Center in Ottawa from May 2019 until January 2020. Crossroads is a nonprofit organization that provides a variety of services for children and their families. Clients are administered an intake battery before accessing the variety of services that the agency has to offer. There were 2 measures used in this study. The Child and Adolescent's Needs and Strengths, CANS, measure is a multi-purpose communiometric assessment used to assess the needs and strengths of the children and their caregivers. This customized version used by Crossroads consisted of 28 items that address the unique assessment needs of the agency and is scored on a 4-point Likert scale. The Strengths and Difficulties Questionnaire, the SDQ, is a behavioral screening questionnaire used to assess children and adolescents aged 4 to 16 years old and is completed by an adult caregiver. The measure's 25 items are scored on a 3-point Likert scale. Bullying groups were decided based on responses to the bullying and victimization items on the SDQ. The selected cutoff scores on the bullying and victimization items in the study were assessed based on the existing trends in the literature. Descriptive, Cronbach alpha, and a MANOVA with post hoc tests were carried out for this study. This study consisted of 91 children, 48.4% female and 51.6% male. The mean age of participants was 8.02, with ages ranging from 4 years old to 11 years old. Within the sample, 97.8% were attending school and 2.2% were not. As well, within this sample, 16.5% were classified as non-involved, 18.7% were classified as bullies, 26.4% were classified as victims, and 38.5% were classified as bully victims. Children in the sample came from low, middle, and high socioeconomic status. The results of the study can be summarized in this graph, and we will go through each dependent variable one at a time. It is important to note that across the graph, a higher score indicates greater severity. The results of the study can be summarized in this graph, and we will go through each dependent variable one at a time. It is important to note that across the graph, a higher score indicates a greater severity of the problem. For the purpose of the study, mental health indicators were broken down into internalizing and externalizing symptoms. On internalizing symptoms, children in the victim group were significantly more likely to experience internalizing symptoms than children in the bully victim, and non-involved group. On externalizing symptoms, children in the bully and the bully victim groups were significantly more likely to experience externalizing symptoms in comparison to children in the victim group. As well, children in the bully group were significantly more likely to experience externalizing symptoms relative to the non-involved group. When looking at parenting challenges, parents of children in the bully victim group were statistically more likely to be experiencing challenges related to their parenting than parents of children in the victim group. On individual strengths, children in the non-involved group had statistically more individual strengths as denoted by a lower score compared to the other groups. The findings of this study shed light onto the specific needs and strengths of each group. The symptom profile of children in the bully group was that they were likely to be experiencing externalizing symptoms, parenting challenges, and have weak individual strengths. The symptom profile of children in the victim group was that they experienced internalizing symptoms and had weak individual strengths. When looking at externalizing symptoms, this group experienced the least relative to the other groups and had the least parenting challenges. The trend that emerged in the bully victim group was that they experienced the most externalizing symptoms, parenting challenges, and the least individual strengths. It is clear from the graph that the bully victim group had the most severe challenges in comparison to the other groups. A clear trend emerged where children in the non-involved group had more individual strengths than the other groups. There were several strengths and limitations in the study. One of the strengths of the study is its multi-informant perspective. Instead of drawing conclusions from a single perspective, this study incorporates the perspective of parents and the clinicians to capture a wider understanding of the needs and strengths of children referred for mental health services and are involved in bullying. Another aspect of this study that adds to its scholarly value is that it sheds light on the experiences of a population of children who have greater needs. Typically, bullying studies involve large community surveys. Rather, this study explores the relationship for children who have been identified as being at higher risk for bullying involvement. The rate in the study far exceeds the national norm of bullying involvement found in community samples in Canada, which stands at around 30%. There were several limitations to the study. The study was limited by the measures already being used by the agency. As such, the categorization of bullying involvement was based on two items, one gauging bullying and the other assessing victimization. While previous literature has shown that the categorization of bullying groups can be done using a single item, using multi-items to capture bullying and victimizations could have shed greater light onto the behavior. Further, the internalizing symptoms and individual strength scales had barely adequate alpha reliability. It is possible that the low Cronbach alpha reliability for internalizing symptoms and individual strengths could have been attributed to the limited number of questions within the scales, that the scale items were unrelated to one another, and the homogeneity of the population. With the children accessing services at a children's mental health agency, it's not surprising that there is limited variability within the responses of internalizing symptoms and individual strengths. As well, since this study uses pre-existing data, the first date of contact is not indicated, and therefore it is unknown if the client had previously received services from the agency. There are several implications of the study. First, with the understanding that different bullying groups have different needs, there is a call for more effective screening methods in mental health agencies so that targeted interventions can be provided to these children. With the risks of bullying involvement varying amongst the different groups, the type of intervention should reflect the specific need. Additionally, to help address the prevalence of bullying involvement in this high-risk population, mental health agencies might find it helpful to use a strength-based treatment approach when addressing bullying involvement. By fostering the child's individual strengths, there is potential to decrease bullying while providing benefits to other aspects of the child's life. Lastly, children would likely benefit from greater collaboration between schools and mental health agencies. Fostering greater communication has the potential to bring alignment and collaboration across the two contexts, leading to more holistic care. This would offer schools greater support to assist children who are experiencing severe challenges that would be difficult to address solely in the school context. Synthesizing the findings and limitations of the study, there are several avenues for future research. To gather a more robust account of bullying involvement, future studies would benefit from including the perspective of the child. Doing so would give voice to the experiences of the child, which can often differ from the perspectives of parents and clinicians. To expand on the findings of the study, it is suggested that the study be carried out using a longitudinal design. This would allow researchers to capture a baseline measure prior to treatment interventions and enable researchers to explore the causal links amongst the variables. While the findings of the study provide an interesting glimpse into the experiences of these children, it is important to remember that the findings provide only a narrow perspective of these children and their families. We do not know why and how these families are struggling and what specifically led them to seek assistance from Crossroads Children's Mental Health Center. Future research would benefit from taking a broader perspective to help answer questions about how and why these families are struggling, as well as what led them to seek out assistance.